Hey there, young historians. We are back with the Civil War, which is really a not-so-civil war. Yeah, it was brutal, it was bloody, and we're going to continually see the new bloodiest battles in U.S. history during this war. We already saw the first Battle of Bull Run, which was the bloodiest battle in U.S. history. Now we're moving on to the Battle of Antietam. Now here's how we're going to do this. I'm going to first actually have you go over to the Google form, and on the Google form there is a link to a short reading. I want you to read just the highlighted part on the Battle of Antietam. It'll probably take you about 2 minutes. Do the reading, answer 1 or 2 questions in the Google form, and then come back here, press pause now. Okay, you're back. So you've done the reading on it, you've answered a couple of questions in the form. Now I'm going to have you go to that next link, which is a GIM kit. Yeah, it's a game where you're going to be answering some questions, earning some money. You're going to go play the GIM kit now to do a little bit of review on past lessons. You can go to the GIM kit now, press pause. Okay, and you're back again. So now you've done some reading on the Battle of Antietam, you've answered a couple of questions in the forum, and you did a GIM kit review, and now we're going to do some review over what happened in the Battle of Antietam. Let's first look at the leadership. We've got the Confederate Army General. He's from the South, right? Well, he's representing the South. General Robert E. Lee. He's technically from Virginia, but he's only across the river from Washington, D.C., and he went to college at West Point Military Academy, which is also in the North. Robert E. Lee decided he could not fight against his home state of Virginia, so he decided to serve Virginia and the Confederate Army in the war. Now, Robert E. Lee decides that he wants to try to win a battle in a northern state, Maryland. He thinks if he can win a battle there, maybe he can convince Maryland to join his side, and he can maybe stop the Union from advancing. So what you're seeing on this map here is the red Robert E. Lee as he's moving north into Maryland, out of Virginia, and getting close to Pennsylvania. And the blue, that's the Union Army led by General George McClellan. General George McClellan is the Union Army general, but you can see the years there, 1861 to 1862. He had a short tenure. Part of it is because of this battle in the Battle of Antietam. So on September 17th in 1862, Robert E. Lee and General McClellan, they meet near Antietam Creek in Maryland. The result is that the Confederate forces retreat, and they retreat because we have a new bloodiest day of the war. The casualties are phenomenal. The Union Army has over 13,000 casualties in this one day. Over 2,000 dead, over 10,000 wounded or missing. The Confederate Army had even more casualties. They sustained 2,700 dead and about 11,000 wounded or missing. 25,000 Americans are dead, wounded, or missing in this single battle. It's a brutal war. It's a not-so-civil war. As a result of this, General Lee says, I am going to retreat. He retreats back to the south. I want to show you some images of how terrible this battle was. This is an image known as the Bloody Lane. It's between 2 farm fields in Sharpsburg, Maryland. There was a sunken road which Confederates used as a rifle pit, kind of a trench. They would hide down in there and shoot out of it. They were overrun by Federal troops, that's the Union, and the road has since been known as Bloody Lane. You can see the image there. Credit the Library of Congress. We also see this one from September of 1862. Several dead soldiers lying outside of Dunker Church, which survived the Battle of Antietam. It was then used as an aid station, sort of a hospital. Okay, so the casualties are massive. And I want to show you something else that happened there in Antietam. It's one of my favorite photos from the Civil War. It's Lincoln, President of the United States, Abraham Lincoln, and his general, George McClellan, meeting in an army tent or a field tent on the battlefield at Antietam on October 3rd, 1862. What I like about this photo is I like to imagine what they're talking about. And I have a feeling that I know what they're talking about because what happens a short while later is President Lincoln fires General McClellan as the Union general in November, just a month later. And so I like to imagine that in this photo here, Lincoln is telling him, hey, McClellan, you've got a better army. You should not be retreating. You should be fighting south. We should not be fighting any more battles here in the north. Get the job done. Get it done right. Quit prancing around. Quit getting lost here. Attack, 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 or else you're done for. Well, Lincoln ends up firing him. I'm now going to have you pause and go back to the reading and just do a short reading called The New Realities of War. And you'll answer a couple more questions in the Google form. You can pause it now. Okay, so you're back. So in the new realities of war, what you're finding out is that there is a horrifying death toll. And part of it is because of new technology, new weapons, and also because of medical care. So let's break that down and take a look at a couple images here. This is some of the new weaponry that is used. Now previously, wars had been fought in hand-to-hand combat, up close, using muskets with bayonets. A bayonet is a long sword or knife attached to the front of the gun. And they would shoot at each other, then run at each other, charge, and attack with the bayonet. Well, now there are new and improved rifles. And basically the barrel, inside of the barrel, has a groove that causes the bullet to spin and be more straight and accurate. Well, these bullets now can travel more accurately and at longer distances. So it allows for armies to fight at long distances from each other and sustain massive casualties. There's also improvements in the types of cannons that were used. Here's a couple of cannons. So there's new technology in the weaponry, but there is also some issues with the medical care. Okay, so as staggering as the battle death tolls were, so deaths from the actual fighting, far more soldiers died of disease than of those wounds. This is because medical care was not able to keep up with the technologies of the weaponry. Civil War doctors had no understanding of the causes of infections. Surgeons operated in dirty tents using just basic instruments. Few of them bothered to even wash their hands between patients. And as a result, infections spread really rapidly from patient to patient. Now there's a couple of things that are pretty gross here. So I've got a little puke emoji here to remind you that the next slide has something that might cause you to be a little bit squeamish or nauseous if you don't like that kind of gross stuff. All right. This first one is not. This is just letting you know this is not a warning here. First one is a Union ambulance. I want you to see what they would be carried on off the battlefield. If you were lucky, you got a ride in one of those ambulances. This is a medicine chest with some of the medicines, the potions that were used to try to heal. And now we're getting the gross emoji. So the next slide has something that's kind of gross. These are some of the tools that were used. Now, what often would happen is if somebody was wounded by a bullet or a mini ball, they might not be able to remove that, and rather they would just remove the limb. It's called an amputation. And so here we've got some of the amputation knives that they would use to remove a finger or a hand or an arm or a leg or a foot from the body. Here's a surgical saw that can get through bones. Here's a bone cutter to cut through smaller bones. The next one is also gross. You might even want to lower your microphone here for a minute or two. Here's a bone saw. This is a bone crimper to pinch the end of a bone so it actually wouldn't punch through the skin. Here's a bullet extractor to pull bullets out of a body. You kind of reach in there like a pinchers or a pliers. A haze saw could get into smaller rounded areas like an eye orbit or a orbital socket there. And I'm not even going to tell you what a trephine is, but yeah, I'm not going to tell you. That's a little bit too gross. You could look it up yourself. The next one is showing you some of the medical drawings of how to actually perform an amputation of an arm. So you can see they would slice off some of the meat, lift the flap up, and then they'd have to cut through the tendons and the tissue here to remove the arm. Next one's gross too. This is showing you a little bit more detailed cutting of the arm, and then what it would look like afterward. They would then take the skin flap, fold it over, sew it up, and the person would move on with their day. The next one's gross too. This is showing how to remove a leg. Cut below the knee there, you could see. And then they would actually cut through the tendons or the ligaments around the knee, and then cut off the calf muscle there, bring that flap back over, and stitch it up again. One more gross one. This is the last one, I promise. This one is in case the wound was a little bit higher. They had to remove above the knee. You can see that they had used the bone saw to cut through that femur bone. Okay, no more gross stuff. This is a prosthetic limb. If they were lucky, they were able to get a prosthetic limb. Nearly 2/3 of battlefield wounds occurred in the extremities, arms and legs. An amputation under anesthesia was the typical remedy, and lucky amputees were able to get a prosthetic limb. After the war, you could often tell who had been in the war when you could see how many, or whether they had amputations or not. A couple of quick uniforms here. I'm not going to describe them all, but just to give you a little glimpse of them, here's a close-up of that one. You can see some of the kepis and the dress hats. Here's a close-up of a Union kepi, it's blue. Here's some blue Union uniforms as well. The US means the United States on that belt buckle. Move on here. This one shows you some Confederate uniforms. Okay. We've got, see the CS, Confederate States belt buckle. This is supposed to be more grayish looking, actually. There's a couple other Confederate uniforms. And this is what I was telling you about the gray or sort of butternut squash color. And one last thing, some of the infantry shoes. Okay, so quick summary here. We covered the Battle of Antietam, the bloodiest battle in U.S. history. We talked about the leadership of the generals on both sides, General Lee and General McClellan. The new realities of war with the weapons and the lack of, you could say, medical care. A little bit about the uniforms. You did a GIM kit review. Lastly, Mr. Huggins is going to be shaving his beard into a Civil War era facial hair style. Yes, I'm going to take these whiskers and turn them into one of those whiskers there. You get to decide by coming into the live lesson and voting on 1, 2, 3, or 4 if you want to have a say on what I look like at the end of 2020 here. Okay, I'll see you next time. Peace.